Now let's see what is a talon cusp. It is an anomalous structure resembling eagle's talon that projects lingually from the cingulum area of permanent incisors. So here are three things to remember. First thing, that it resembles eagle's talon. Second thing is that it projects from the cingulum area. And the third thing is it is prevalent in the permanent incisor. So it is a cusp-like structure, an accessory cusp you can say, or which projects from the cingulum area of the maxillary incisors, and it resembles the eagle's talon. Now between the junction of the tooth and the talon cusp, there is a deep developmental groove. Now question arises, is this structure normal? Is this structure consisting of normal enamel and dentine? So the answer is yes. It is composed of normal enamel and dentine, and it also contains a horn of pulp. Now, what can be the problems related to talon's cusp? The first problem is of aesthetics. Suppose, look at this diagram. This is the talon cusp which is shown here. Suppose this is too long. It projects like this outwards. So this will not look good. This is unaesthetic. Second, caries. The second problem is caries. I said that there is a deep developmental groove. There is a deep developmental groove where the cusp blends with the tooth. So this groove is very prone to caries because food lodgement can occur there. Then the bacterial growth will start, and which will lead to caries. Third is occlusion. This talon cusp will hinder the occlusion. How? See, if this tooth, in this tooth, if this talon cusp projects outwards, it becomes longer. So obviously this is going to hinder the occlusion. Now, there is a syndrome with which the talon cusp is associated, and the syndrome is called Rubin, Steen, Tybee syndrome. What happens in this syndrome? First, talon cusp. Second, developmental retardation of the patient. Third, broad thumb and toes, and delayed descent of testes occurs. So what is talon's cusp? It is an anomalous structure resembling eagle's talon. It projects lingually from the cingulum area of the permanent incisors. Let's study the next developmental disturbance, that is taurodontism. So the term taurodontism was given by Sir Arthur Keith in 1913. Now what is taurodontism? It is a peculiar dental anomaly in which the body of tooth is enlarged at the expense of roots. So in this, the body of tooth is enlarged and the roots are shorter. It means bull-like teeth. So they resemble the teeth of a bull. So they have given the name bull-like teeth. Now what is the cause of this? Now some scientists believe that it is an atavistic feature. Some believe that it is a Mendelian recessive trait. Some also say that it occurs due to mutation. But it is believed that it occurs due to failure of hairs to invaginate at proper horizontal level. Now, what are the different types of taurodontism? First is hypotorodont. It is the mildest form. Then is the mesotorodont, that is the intermediate form. It is intermediate between hypotorodontism and hypertorodontism. And what is the hypertorodontism? It is the extreme form. Because in this diagram you can see that the bifurcation, this bifurcation and the roots, they are not very far away from each other. Bifurcation is very near to the apices of the roots. Now let's see what are the clinical features of taurodontism. First, it is more prevalent in the permanent dentition than in the deciduous dentition. Second, it mostly affects molars. And third, it can occur unilaterally as well as bilaterally. Now let's look at some radiographic features of taurodontism. The first point is teeth is rectangular in shape. Now as you can see in this hypertaurodont, see the shape of the teeth. It's almost rectangular, right? Then the pulp chamber is extremely large. Now look at the normal teeth, the pulp chamber of a normal teeth, and look at this pulp chamber. This is enlarged. The tooth has short roots. See the normal roots and the roots which are present in the hypertaurodontism. There are actually no roots almost. There are no roots. There are very short roots present. The bifurcation is few above the apices of roots. We have already seen that in hypertaurodontism, the bifurcation and the apices of root, they are very close to each other. They are not far away. So they are only just few away from each other. So the bifurcation is few above the apices of roots. See this diagram. This is the apices. This is the bifurcation. This distance is just few millimeter. So what is taurodontism? It is a peculiar dental anomaly in which the body of tooth is enlarged at the expense of roots. It means bull-like teeth, and the term was given by Sir Arthur Keith in 1913. The next developmental disturbance that we'll study is enamel pearl. It is also called enameloma, enamel drop, enamel nodule, enamel globule, and enamel knot. So these are the various names of enamel pearl. Now, what is enamel pearl? It is the ectopic formation of enamel in the form of globule on the root surface. Ectopic formation means at a location which is not normal. If enamel is getting formed at root surface, that is an abnormal position. So, the ectopic formation of enamel in the form of globule on the root surface is enamel pearl. Now, where it is usually located? It is located in the CJ or in the cervical third of the root surface. Now, what are its clinical features? It is yellowish white in color. It is spherical. The diameter is 1 mm to 3 mm. It is asymptomatic. It is not clinically visible. Then, it is seen as a hemispherical radiopacity on the root. So when we see the radiograph, there will be a hemispherical radiopacity on the root. Then, sometimes it contains a small core of dentine and a strand of pulp. So it has also been seen that this enamel pearl also contains some dentine and a pulp. Now let's see how it is formed. So what happens during root formations? Some of the Hers cells, they remain on the root. These cells, they differentiate into ameloblast, which produces enamel matrix on the root surface. So, what is enamel pearl? It is the ectopic formation of enamel in the form of globule on the root surface.